Spotlight with the Innovation Spark. If you're just tuning in, my name is Ammishaddai Ofori. I'm director and co-founder of the Innovation Spark, and we are live on Innovator Spotlight. So you can find us on LinkedIn, YouTube, and Twitter, now X. And I'm super excited today. Why? Because of my guest. He is founder of Rivia, which is a platform partner with clinics to provide quality healthcare in Ghana and Africa. But prior to this, he has had multiple experiences in the startup ecosystem in Ghana and across Africa. For those who know about Starbucks, that was acquired by Trips. This is the gentleman I'll be speaking with. He has an amazing wealth of insights. I'm personally happy to have worked with him briefly at an accelerator program. And today I'm excited to introduce Isiore Kpotufe. Isidore, welcome.
Hi, Amish. How are you?
I am alive and well, Isidore. Thank you for joining us. How have you been?
I'm very great. Starting of the year strong, and we can only thank God. I'm happy to be here. I'm happy to chat with you.
Yes, and I'm super happy because it looks like you're already on a momentum talking about Rivia, so this will just be a continuation of it. And you put on your post about the importance of Rivia. I remember commenting, telling you about my mom fainting and going to the hospital, and she was left alone for a whole hour. This was someone who had fainted. And so you couldn't have hit the nail right on the head by introducing Rivia. Tell me a little about the background of Rivia and how you came about starting it.
Yeah, thank you, and great to be here once again. Last year in March, I went to the hospital. I went to the clinic to get treated for an ear infection. It was in March 5th specifically, and I was in the office at the time. My office is somewhere around the Awudome estates. So I put in the Google Maps, clinic near me, and the nearest clinic was seven minutes away. So I just drove there. As soon as I got to the clinic, I wanted to leave because I didn't have the confidence that I'll receive the right and quality care in this clinic. The walls were just, dilapidated. I saw papers everywhere. It's old furnishing. The melancholic feel of the space just didn't give me confidence. So I was standing there in at the reception. A doctor walked up to me and introduced himself and said, "Hi, Isidore. My name is Dr. Baini. You called." I said, "That's true." So yeah, I will be treating you today. I said, "Okay, nice." His reception was warm. So I loosened up a little bit. We got talking. I went to the consulting room, a very tiny consulting room. Um, and we talked. So fast forward, I got the treatment the next day around 12 p.m. I felt instantly better, very better. What was happening the previous day was really bad. So I called him to thank him for the treatment and to tell him that I was feeling better. But then I told him that I had a confession to make. I told him I nearly left his clinic and I got there yesterday. And he asked why. I told him that the place wasn't really great and I didn't think that I was going to receive quality care. So he said, "Yeah, you're right. You're right about this. You're not the first to complain about this. Everyone has been complaining. And so we're trying our best to make it better, Then that experience got stuck in my head. I knew that at some point, within the year, my journey with Trips would be coming to an end. To Trips, the company that acquired my previous startup. So I knew that it wasn't also the last for me in the entrepreneurial world. I was still open to different opportunities. So I kept thinking about what to work on. I looked at different sectors, healthcare, financial services. I looked at even the international market, what could be done in that space. So I thought about a lot of things, it's how it is in the entrepreneurial world. You have a lot of ideas competing for your attention. Then for me, the decision was that what can I do that would ultimately go beyond me and touch, billions of people in a very effective way, and had done something similar in transport. And then healthcare was a natural sector for me. If you look at the healthcare sector and look at my experience,
Mm,
Many folks are receiving service that is way below the expectation.
that's very true.
Folks are in billions of people in Africa. All right, some
Mm,
don't know it, others know it. So I decided I was going to I was going to do something in healthcare. And by the way, Rivia came about while I was in Cape Town. We
okay.
launched Rivia. We did everything in less than 2 months, even though the idea itself had been, in the background. We've been trying to make it work. The work to
Mm,
launch Rivia, started in November last year. And
okay.
when I was in Cape Town when we acquired our first clinic, I wasn't even in Ghana yet.
Yes.
Yeah.
Oh my,
So that's the story. That's the background.
that's wild. So where did you end up getting your healthcare service for your ear infection?
No, no, the same clinic, except that I got so the treatment was great. The next day I felt better by the same
Okay.
doctor. And by the way, you wouldn't believe this doctor is now on our team. It's part of the founding team.
Awesome. That's
Yeah,
great.
yes.
And
So the
I am
same
so
clinic, the same clinic treated me, except that I didn't believe that they would be able to give me quality care, looking at the
mm,
state of
just because
infrastructure.
of how the place looked like. Oh my goodness.
Exactly, the state of infrastructure. It was really bad. You know, I think they've
Mm,
done some few improvements recently. Last time I went to see them, and which is great as
mm.
well. It means that they are taking feedback into account. Yeah.
Okay. Is this clinic enrolled on Revia now?
The first clinic,
I love that story. This
our first
this is
clinic.
the origin story. Thank you for sharing, Isidore. And before we come back to Revia, just a quick appreciation of what has happened in the startup ecosystem in Ghana this week. So we just want to banter a bit about what's happening in the ecosystem. This week, we've seen a couple of interesting news. Habtel published its end of year um, report, and it said that it had processed 160 billion Ghana cedis worth of transactions last year. Now it's processed 160 billion worth of transactions. So we don't know whether it's a revenue or profit, but the sheer volume of funding going through Habtel as a platform, we thought it was worthy news. What did you think about it?
Yeah, I think that we're making progress. Fintech has always been a very challenging space in Africa. A lot of fintechs are struggling. did fintech in the past. My first startup
Mm,
was a fintech. It was a price comparison marketplace for comparing
remember.
financial services. Yeah, and so I have had the opportunity to play in the space briefly. And so it's good to see the progress that Habtel is making. I am particularly proud about the work of Habtel, seeing where they
Mm,
came from
mm,
SMSGA to the transformation that they had to go
right.
through, to becoming right. They're providing, delivery, logistics, providing payment services, providing cash management services, providing digital communication services. So I am very happy with the progress that Habtel is making. Compared to what is happening in other part of the continent, like Kenya,
Yes.
Ghana,
Mhm.
Kenya, Nigeria. I mean, the big four, right?
Mm,
Kenya, Nigeria, South Africa, and Egypt. It's still a very long way for us to go.
mm,
So 160
okay.
billion Ghana cities is about 60 million, or even
Yeah,
less dollars, or even less dollars, depending on the exchange rates. And that's not revenue. That's not profit. That is
that's true.
total transaction volume, right? On the platform, the value of transactions that has
With
occurred,
every process.
via the Hapta platform.
Mm,
And that's very minuscule, compared to what is happening in other markets like Nigeria,
mm,
Kenya, and so on. That also leaves room for growth, and I'm hoping that Hapta will be able to position itself to capture that growth, to capture that potential. I see opportunity in offline payments, and hopefully they are
mm.
positioning themselves to capture those opportunities, because today more than 80% of transactions still occur offline. So
Offline.
who's powering offline transaction?
Okay, so 160 billion, kudos to them. We're all about celebrating the small wins and the big wins, but there's more room for capturing 80% of transactions that are still offline. Thank you for that. And Copianto, that's one of Mest startup portfolio startups. Copianto AI was recently recorded for securing 100,000 from Shark Tank Malta to expand to Europe. Are you familiar with them? What do you think about that?
Yeah, I'm familiar with Copianta. I met Daniela. If you had the opportunity to meet her this December
Mm,
program, we talked briefly, and first of all, I respect her courage for leaving the
mm,
corporate world to get into entrepreneurship. Not easy.
yeah.
She trained as a lawyer, um, so that's great. I
Mm,
congratulate her and the team. I also want to I want to use the opportunity to highlight one issue, one challenge that we're facing in the market in Africa.
mm,
Um, the value of what Copianto is doing is great. They're trying to automate legal work using artificial intelligence.
mhm,
There's so many legal lawyers today are burdened with so many cases, especially in the public sector. In the public sector,
mm,
a lot of
mm,
legal practitioners are burdened with huge volumes of cases. And one of the ways to address these issues, one of the ways, not the only way, is to
mm,
automate some workflows, and solutions like Copianto can help in that regard.
mhm.
But we need to develop solutions like that. We need to invest in the development solutions like that locally. We're not doing that, and we are waiting for we are leaving these opportunities to countries like Malta or Europe or investors in US to
Yes.
to to discover these opportunities and invest in these opportunities. What's going to happen is that the value that would result or that would come out of Copianto cannot be retained in Ghana, will not be retained in Ghana,
Mm,
because we're not investing in the likes of Copianto. All right.
right.
So that is a big issue. It's going to cause intellectual or IP drought. We wouldn't have um, any leverage in terms of intellectual property. So it means that
Mm,
and today the world today, the value of an economy revolves around how much value they're able to retain from their intellectual property, with local intellectual property. All right.
mm,
That's one challenge that we need to highlight. Malta is creating that. The next thing you're going to see is that Malta is making it easy for entrepreneurs from Africa to easily obtain visas to go to Malta and build from Malta. Uh,
correct.
and the next thing is that you're going to see that the government program exists in Malta to provide some support, some market linkage support,
Mm-hmm.
stakeholder engagement support to companies like Copianto to
Mm,
enter Malta and use Malta as a hub to enter Europe or other markets.
mm,
So that is causing this drought of intellectual capital on the continent. It's very risky for the future of the continent. Very risky.
mm. Wow. Well, that feels like a prediction if we don't put the right measures in place, and I can already see it happening. That was really well mapped out, and it's scary, but I do see it happening as well. Well, let's quickly go through the last few ones because I want to get back to talking about Rivia once again. 1 billion dedicated to Africa's startup ecosystem. This was at the last, just before Davos. The Africa Innovation Fund was set up. It's called the Timbuktu Africa Innovation Fund. And I found it particularly interesting. So it's $1 billion for the whole of Africa for innovation. And I think it's pretty small, isn't it? But I guess it's something that we can celebrate. Your thought?
Yeah, I think it's small as well, given the size of the opportunities on the continent, right? I mean, last year alone, we raised about startups raised. I mean, the first quarter of last year, we raised about a little over $2 billion in equity funding in just a quarter, right? In just a quarter,
Mm-hmm.
and this funding was skewed towards some specific markets, including the big four: Nigeria,
Mm-hmm.
Kenya, South Africa, and Egypt, along the other market that managed to also attract equity funding. So if you look at the fact that last year in Q1, we were able to pull in more about $2 billion in equity.
Yes.
and then the total asset and the management of this fund that is going to be dedicated to the entire African continent is 1 billion. You can see the disparity in terms of
Mm.
in terms of what you can do. But I think it's a start, right? It's a start. But I have
Yeah.
my reservations around how this is going to be a success. Government
It
is
is,
heavily
isn't.
involved. Government is heavily involved in this fund. And look, there's so much empirical evidence in Africa to suggest that anything government is involved in sees little progress. It's the fact. I had the opportunity to also to be part of the stakeholder engagement event for the Timbuktu
Okay.
uh, fund in South Africa. The lead on the project, I forgot her name. She presented. She made an electrifying presentation around on the Timbuktu fund
Mm.
and galvanized for support to make it a reality.
Okay.
Yeah, different inputs, but my like I said earlier, my position is that given the heavy involvement of government in the actualization and implementation of the fund, it would be. I mean, this. Let's just wait and see. That's what I would say. And that's commitment, by the way. This is not money that we've raised already. We don't have this 1 billion yet. These are
Mm.
this
It's
is
just
plan.
commitment.
Yeah, plan. Not even commitment. You plan to raise this $1 billion. As part of the $1 billion, governments are supposed to contribute some amount of money, and we know that not all of them have contributed this amount yet.
Oh.
On the basis of this commitment, other investors like private equity funds, venture capital funds, foundations, and all of that would also contribute or match government's contributions. And let's see how it goes. Like I said earlier.
Well, fingers crossed. You're right. I do agree that it's a start. I was also very skeptical when it was announced that there's going to be a heavy government involvement, and we've seen funds of funds. We've seen what happens when funding is channeled through government states, government-run institutions. But fingers crossed, and I hope we can keep them accountable. Dr. Do Good, also one of the health tech startups here in Ghana, doing amazing things, giving you easy access to clinicians and also medical aid. Should be right there in your alley as well. Recently partnered with Yamachi Biotech to improve access to cervical cancer treatment. Now, I thought this was brilliant. It gives the everyday person who might otherwise not have access to cervical cancer treatment the ability to get professional help. What do you think about it? It's also right in your alley, so I'm curious to see.
No, I think it's really the right way, the right move. Partnership in healthcare is the way to go. There's no
Mm.
company, there's no one single company that can solve the healthcare in Africa, and particularly in the areas of research.
Mm.
Research is a multi-party, a multi-stakeholder, enterprise. So,
Mm.
and particularly in the area of cancer, I
Mm-hmm.
think that we haven't made significant progress in the cure for cancer, in Africa, particularly, is because look, we ourselves have not been involved so much in the research and development part
Mm.
of the cure, and so the way to address that is to partner, is to create platforms where we're able to partner and then combine our efforts and resources to bring about resolutions or some or addressing a
Mm.
cure. So I think it's the right approach. We ourselves at Rivia, we're thinking in the same light. We would be we're already in the process of creating alliance of different healthcare
Okay.
providers to address some key or some core issues affecting the space.
Mm.
One is funding, of healthcare services. Second is the state of the conditions of work of healthcare practitioners,
Mm.
research and development, infrastructure gaps.
Mm.
So these are some of the things, and then drug discovery. What you
Okay.
find is that a lot of the drugs we use in Africa depend on research and development conducted outside, and
Right.
so if not, that is a risky proposition as well. All right.
Mm.
So I believe is the right approach to go, and given that we are thinking the same way at Rivia.
Okay, so kudos to Dr. Do Good. We are rooting for you. And finally, you can get more updates on what's happening in the Ghana tech and startup ecosystem by following the Innovation Spark and Ghana Innovation Journal on all social platforms. The last updates this week that I want to highlight is why Isidore is also here with us today was Rivia. So former Trips CMO Isidore launched Rivia, an asset light healthcare chain. And today we just want to dive deeper into why he set it up, what are his expectations for setting up Rivia, and what we can expect from Isidore and Rivia going forward. I mean, Isidore, kudos to you. You are a good example of someone who is tenacious and has worked through the different startups, right? Like he mentioned briefly, he started with a fintech startup. I think you started another one before coming to Starbucks, right? And then finally we see you launching Rivia as well. You've already told us about the inspiration behind Rivia. So let's go on to what you think the state of healthcare in Ghana is like. Your honest opinion and why you think Rivia is relevant.
Yeah, thank you. Let's start with the figure. The the doctor to patient ratio is one doctor to 2,000 to 3,000 patients.
That's
Uh,
crazy.
and and if you think about this, you can imagine why there's stress on our public um, healthcare infrastructure or system or our
Mm,
healthcare system. If you think about this, um, it unfortunate that we don't think it's a crisis. This is a huge crisis in the
mm,
sense that it's depriving millions of people of quality care, not
mm,
receiving the right care. Any nation that is not able to look after its people is a nation in crisis. Is a nation that does not have a future
mm.
because because you can't build an economy with sick people. You cannot.
True.
You cannot build. You cannot have a future if children are not well. They are not healthy to go to school.
Mm-hmm.
And learn, get educated,
Mm-hmm.
become engineers, the scientists, the entrepreneurs that create value for the economy. Um, it's, I think for me, it's straightforward, right? But for some reason, some folks, some people who have the responsibility to incentivize the private sector to look at healthcare are not doing so very well. And so
Mm,
we as private sector, we as entrepreneurs need to step in now before
mm-hmm.
before it becomes too late. Before when you look at the pandemic, for example, Africa, frankly, was the least affected with the COVID-19 pandemic, right? But
Mm.
we were the continent least prepared to tackle it.
Right.
Why? Because we didn't have the infrastructure. They have infrastructure to do that. So that is
Mm,
a big shame. It's a big shame. Imagine if half of what had happened in Germany or in Europe, in Asia, had happened on the continent, it would have been so
yeah.
disastrous during
In
the
a
pandemic.
collab.
It would have been disastrous. You understand? So I think that is the right moment for us entrepreneurs to step into the space. There are different
Oh,
solutions we can provide, right? I mean, you asked a question around the state of healthcare in Ghana today. So there's a shortage of healthcare practitioners, from
yes.
doctors to specialists to nurses to other frontline support workers. There's that issue. There's the issue of quality of care. This is not because doctors or the healthcare practitioners don't want to provide quality care.
Mm,
It's because of two things, or maybe three. One, the lack of equipment and infrastructure. If you
mm,
go to a clinic and the clinic does not have the right infrastructure, whether public or private, does not have the right
mm,
infrastructure equipment to treat you, the experience will not be great for you, the patient. You're going to blame
mm,
the doctor or the nurse or the clinic for sure, but it's not their
for
fault
sure.
because they don't have the equipment. Either they don't have the money to buy the right equipment, or
Mm-hmm.
they are not compelled to do so for some reason.
Mm,
The other thing is which can affect the quality of service. is the fact that there's no accountability in the space, right? So beyond
Okay.
the fact the health practitioner themselves, they are good people. These are mothers, and I don't think that doctors and nurses are bad by nature. I don't think so. Sometimes we like to paint them aside, but
They
the
don't have the.
system the system does not make them accountable for their actions, and that's the fact.
Okay.
Because in other jurisdictions, you're accountable for not just for delivering the service to the patient, but for what
Mm.
happened to the patient. What happened to the patient
Mm.
during and post care. But
Okay.
in our case, you go to a hospital or a clinic, you receive treatment from this facility. What happens
Mm.
to you as a result of that treatment is none of the clinics or the facilities concerned, and
Mm.
we don't do anything about it. And so we're not keeping these folks accountable or the system accountable, and that that leaves every system that is not put in check would always have
Mm.
this kind of these dysfunctionalities. All right.
Mm.
The other thing is about the lack of infrastructure, investments, but that
Okay.
is going to change in the next 5 to 10 years. We see the interest of private large-scale investors who invest in infrastructure, in healthcare infrastructure on the continent,
Mm.
from diagnosis centers to specialist facilities to primary care facilities. We already
Mm.
seeing some positive signals around the space in terms of infrastructure investment. That's good. Now there's so many ways we can address the state, okay, the state of quality of service in healthcare. One is to um, provide telemedicine services, right? That's what most interventions are about. What I've seen so far in the market, the likes of
Mhm.
Dr. Good and the other ones in the system as well.
Yes.
Um, but I'm not sure telemedicine or creating a platform that connects patient to doctors or to healthcare practitioners is
Mm.
the sustainable way to address the state of healthcare as I explained it. So maybe
Mm.
it's something we can talk about as we go, but yeah, that's it.
No, I find first of all, I found that statistic staggering. So one to 3,000 patients, telemedicine will obviously increase that ratio. And your approach is to improve the existing healthcare services that are in our brick and mortar, and also just improve the quality of delivery. Unfortunately, we are almost at the end of this conversation, but the most important question I wanted to ask you today is why Rivia? What's the secret sauce? Why do you feel like you are the best person to solve this? And especially having tech background, what is going to be the role of tech in providing quality healthcare? So if you could put all that together,
Very loaded question. I
it
try
is.
to I try to answer it. So, um, Rivia itself is a tech company before anything else. But a tech company is not what you see. Tech is not the solution to every
Mm,
problem on the continent. So we need to understand this because we've
mm.
had so many tech solutions and they're failing all the time. So
Yes.
we need to go back to the fundamental. What does it take to provide better care to a particular clinic or to a patient, and
Mm.
what do we do? How do we build from there? That's the question for that we're trying to answer. So
Mm-hmm.
if a clinic needs money to upgrade a certain facility, let's say their maternity ward, we will provide the financing to enable this clinic to upgrade their maternity ward. This in
Okay.
turn would result in better care for the patient. If the patient is satisfied, they will then, refer more patients to this clinic, which means
Mm.
business growth for the clinic. Which means that if the patient is sick at home, they wouldn't want to self-medicate for the first time. Because then there's quality care that is expected.
Okay.
All right. Now,
Mm-hmm.
technology comes in many ways to scale this effort.
Mm-hmm.
One is to provide technology to the clinic to
Mm-hmm.
run their internal operations so they are more efficient.
Mm-hmm.
Two is to provide technology to the patient to manage their relationship with the clinic. So,
Okay.
do you have your health records anywhere today, Amish, that you can point to?
I did
Yeah,
not.
that is an unfortunate reality. So one of the things that we're doing at Rivia is to create a customer-facing interface that allows patients to have
Mm,
access to their health records, that allows patients to have a personalized health plan. So your
mm,
health is different from mine. It's different
mm,
from the millions of other people out there, and the
mhm.
application is able to tell you, it's able to personalize your health journey based on your health as a person,
Okay.
right? There's so many ways we are looking at using tech. One of the
Mm,
ways I share briefly with you is that we are extracting data in ethical ways. We're extracting
okay.
data happening on our platform to build
Mm,
our own core foundation model for the application of artificial intelligence in healthcare delivery.
mm,
And so let me just break this down quickly. What it means is that
okay.
you will not have to visit a doctor to be able to have diseases diagnosed. You can
Mm,
go to an application. You can go to an application, a review application, put in the symptoms and
okay.
other ways you feel, and the application is able to instantly diagnose the way you feel based on raw and local data from Africa. Right. So that's
You
one
don't?
application of data from Revia. I mean, there are many other ways that we can talk tech and Arabia and what the unique source is, but the time will not allow it. So I'll pause here.
Yes. Isidore, thank you so much. This is what we are going to do. We are going to have another session where you're going to, first of all, let us know your progress since you started. So let's look at mid of this year, going to Q4 of this year. We will look at the progress of Rivia since you launched, how you've been able to leverage the technology, and also the importance of data for Rivia. And we'll be happy to get what your next expansion plans are. How does that sound?
Sounds great. I'm always happy to talk to you, Amish, and congrats on the great work you're doing for the tech ecosystem. We need people like you.
Thank you, Isidore. Just quickly, if people are looking for you or Rivia to engage your services, how can they find you?
Yeah, on social. So the website, the first place to go to is the website is RiviaCo.com. So Rivia is spelled RIVIA, then co.com. We are on LinkedIn as well, RiviaCo. Um, yep, that's it.
All right. So that's I've been speaking with Isiore Kpotufe. If you're just joining, this is the Innovator Spotlight by the Innovation Spark. And I've been speaking with founder of Rivia, which is a healthcare enablement startup platform. They provide technology and services to help healthcare clinics, healthcare solution providers, clinics to provide better solutions. My name is Ammishaddai Ofori with the Innovation Spark. We have our conversations every 2 weeks, Thursdays, on all social platforms, and you can follow us on the Innovation Spark on all social platforms and also the Ghana Innovation Journal. This has been proudly sponsored by the Innovation Spark and also all the many startups that we support. Thank you all so much for joining. Isidore, a special thanks to you and congratulations once again for officially launching Rivia. We'll be following everything you're doing and be sharing with our audience as the year goes on.
Thank you so much, and thanks to your audience for joining us. Have a lovely evening, and let's stay in touch. Cheers.
Splendid.
Yeah.